Many people believe COVID isn't a big deal, so why even consider getting the vaccine? The COVID-19 vaccines are very safe and effective. COVID vaccines provide two important benefits. They reduce infection and reduce symptoms. First, COVID vaccines reduce your risk of getting infected with the virus. Consider the vaccine like an umbrella in the rain. An umbrella can keep you dry, sometimes completely. But if it's raining very hard, an umbrella won't prevent you from getting hit by some rain. In the same way, the COVID vaccine protects you from infection, but sometimes not completely, especially if you are exposed to a lot of virus at once or are vulnerable because of existing medical conditions. No vaccine is perfect. But the vaccine is the most powerful part of your protection measures, which includes, as recommended, wearing a mask when indoors in public, washing hands, and distancing. Even staying healthy and exercising can help reduce serious disease. Second, like an umbrella that reduces how wet you get from the rain, the COVID vaccine reduces how sick you'll get if you get infected. How do we know that? Because most hospitalized COVID patients, and nearly all who die from COVID, are people not vaccinated. COVID vaccines have worked well in preventing hospitalizations and deaths, even with new variants. How does the risk of serious side effects from vaccination compare to the risk of complications from COVID disease? Imagine a football stadium completely filled with 70,000 adults. If they were all unvaccinated during the Delta wave, about 6,700 people would have been infected with COVID. About 700 would have ended up in the hospital. 1,700 would have become long haulers, living with ongoing issues such as headaches, troubled breathing, constant fatigue, loss of taste or smell, and 50 people would have died. If, however, all of these people had been vaccinated, there would only have been about 800 COVID cases, 75 hospitalizations, 170 long haulers, and 4 deaths. Now what about Omicron? Its wave has caused a lot more cases than Delta, but fortunately most have been far less severe. However, because there are so many more cases, people still have been hospitalized and some have died. The vaccines have also worked very well against Omicron, especially in preventing serious disease and death. Most cases of serious disease and death are among the unvaccinated. What will come next with COVID? It's uncertain, but we do know the vaccines have worked very well to keep people out of hospitals and from dying. So COVID vaccines protect most people most of the time. In fact, people who have had COVID can still get it again, so it's important also for them to get vaccinated. COVID vaccines help protect you, even if you have already had COVID. But wait, there are even more benefits. Because vaccination reduces your chance of hospitalization, it also reduces your potential for hospital and prescription bills. The vaccine also shortens virus shedding if you do get infected, so you're contagious for less time. This reduces the chance of infecting those around you, your children, parents, grandparents, friends. Vaccination leaves you better protected if you need to travel on buses, trains, or airplanes. When you vaccinate, you help protect yourself, your family, and your friends.